The journal article that I found is called Understanding HPV Vaccination Among Latino Adolescent Girls in 3 U.S. Regions. The article stated that Latinos have the highest rate of cervical cancer than any other ethnic group. 11.8 out of every 100,000 Latinas have cervical cancer. This is because of the underutilization of the PAP test and inadequate follow-ups. HPV vaccines prevent cervical cancer and are recommended for adolescents 11 to 12. Research by the National Immunization Survey showed that despite the success of the vaccinations, there has been a slow decrease in the immunization of the HPV in young adults. After a set of surveys around the country in 2009 that targeted low-income Latino families with at least one female ages 9 through 17, it revealed that less than one-third of the females had received at least the first vaccination. Some of the reasons behind not vaccinating Latina females were the promotion of sexual behavior, fertility problems, future health problems, and lack of information. The study showed that the best way to help improve the HPV vaccinations was by educating the Latino community. There was a lot of myths about the vaccines and about the safetyness and effectiveness of the vaccines.
An HPV case study compared the experiences of 7 industrialized countries in considering the approval of the world's first cervical cancer preventing vaccine. Journal newspapers analyzed the public debate about the vaccine, examined the positions of stakeholder groups, and the influence of the outcome of the policy process. The conclusion showed that these countries approved the vaccine and established related immunization programs, although they didn't know if the vaccine was effective and there were many uncertainties. Even though positions differed among countries, all 7 decided to publicly fund the vaccine. This shows that there was a widespread convergence of interest. It is important that decision makers adhere to transparent guidelines so that in the future they are able to make vaccines that are accessible and equal to everyone. The National Cervical Cancer Coalition helped promote cervical health awareness by announcing that January was the awareness month. They tried to communicate to parents and others about the virus so that they knew how to prevent it. And they wanted us to help make a difference and spread a word. The use of technology was encouraging people to tweet about HPV. Here are some sample tweets. For example, one of them said, "Lower your risk of getting HPV, human papillomavirus, the most commonly sexually transmitted disease," and it provided a link so that people could learn more about it.